and I'd like to welcome you, Dejan Javorac. Thank you.
Good afternoon, everyone. Welcome to my presentation. My name is Dejan Javorac. I am a researcher at the Applied Bioenergetics Lab and a teaching assistant at the Faculty of Sport and Physical Education, University of Novi Sad from Serbia. Today, I am presenting the usage of hydrogen-rich water as adjunct treatment for sports injuries. This topic is of great interest due to its potential benefits in enhancing recovery and reducing inflammation in athletes. Thank you for joining me, and I hope you will find this presentation informative and engaging. My doctoral dissertation is related to molecular hydrogen, its impact on sports performances, its application in various sports injuries, and the speed and quality of recovery. Sport injuries, such as sprains, strains, and contusions, are common among athletes. Those injuries can significantly impact performances and require adequate treatment to ensure quick recovery. Hydrogen-rich water is infused with molecular hydrogen, known for its powerful antioxidant properties. Recent studies suggest that hydrogen-rich water can reduce inflammation and oxidative stress, making it a promising adjunct treatment for sports injuries. Hydrogen-rich water gained attention in the sports and medical communities for its potential benefits in treating sports-related injuries. This presentation will explore the science behind hydrogen-rich water, its mechanisms, and how it can be integrated into athletes' recovery protocols. Hydrogen-rich water has been infused with molecular hydrogen gas. Molecular hydrogen is a colorless, odorless, not toxic gas with antioxidant properties. When dissolved in water, it can offer various health benefits, particularly in reducing oxidative stress and inflammation. Molecular hydrogen can selectively neutralize the most harmful free radicals in the body without affecting beneficial reactive oxygen species. Hydrogen-rich water has been shown to reduce inflammation by downregulating pro-inflammatory cytokines and modulating signaling pathways involved in inflammatory responses. Hydrogen-rich water can help protect cells and tissue from damage by reducing oxidative stress and supporting cellular repair mechanisms. Unlike some other antioxidant drinks, hydrogen-rich water generally maintains a neutral pH, making it easy to consume without upsetting the stomach and other benefits. Unlike conventional antioxidants, molecular hydrogen selectively targets and neutralizes only the most harmful free radicals, sparing beneficial reactive oxygen species that are important for cellular signaling and immune response. Hydrogen molecules are extremely small, allowing them to easily penetrate cells' membranes and access cellular structures, including the mitochondria and nucleus, providing protection at the cellular level. Hydrogen-rich water is quickly absorbed and distributed throughout the body, allowing for fast-acting benefits, especially useful in acute injury scenarios. Hydrogen-rich water is safe for consumption in high amounts and does not produce toxic byproducts, making it suitable for long-term use in athletes and individuals recovering from injuries. Antioxidant and anti-inflammatory properties of hydrogen-rich water, which can be seen in the picture. Molecular hydrogen is a selective antioxidant that primarily targets and neutralizes the most harmful free radicals, such as hydroxyl radicals. This selective action helps reduce oxidative stress without disrupting the beneficial roles of other reactive oxygen species that are essential for normal cellular functions. By neutralizing harmful free radicals, hydrogen-rich water reduces oxidative stress, which is a key factor in cellular damage and inflammation. Oxidative stress occurs when there is an imbalance between free radicals and antioxidants in the body, leading to cell and tissue damage. Hydrogen-rich water has been shown to downregulate pro-inflammatory cytokines, such as tumor necrosis factor, interleukin-6, and interleukin-1. Those cytokines play crucial roles in the inflammatory response and are often elevated in conditions of acute and chronic inflammation. Hydrogen-rich water modulates key signaling pathways involved in inflammation, such as NF-kappa pathway. By inhibiting the activation of those pathways, molecular hydrogen water helps reduce the overall inflammatory response. In the next part, I will talk about protection cells and tissue by hydrogen-rich water, such as upregulation of antioxidant enzymes. Hydrogen-rich water has been found to enhance the activity of endogenous antioxidant enzymes, such as superoxide dismutase and glutathione peroxidase. Those enzymes play a vital role in the body's defense against oxidative damage and support cellular repair processes. Mitochondria are particularly susceptible to oxidative damage due to their role in energy production and generation of reactive oxygen species. Hydrogen-rich water helps protect mitochondrial function by reducing oxidative stress within those organelles, thereby supporting cellular energy metabolism and preventing cells death. By reducing the levels of pro-inflammatory cytokines and inhibiting inflammatory signaling pathways, hydrogen-rich water helps mitigate tissue damage caused by excessive inflammation. This is particularly important in the context of acute injuries and chronic inflammatory conditions. Hydrogen-rich water has been shown to promote vascular tissue repair and regeneration. This is achieved through its combined antioxidant and anti-inflammatory effects, which create a more favorable environment for healing. Molecular hydrogen helps protect the extracellular matrix, which provides structural support to tissues, which is essential for tissue strength and resilience. Scientific evidence and studies of hydrogen-rich water. A study published in journal Nature Medicine by Oksara et al. Was one of first to demonstrate the therapeutic potential of molecular hydrogen. The study provided evidence that hydrogen acts as a selective antioxidant, reducing oxidative stress and protecting cells from damage. A study published in Inflammation showed that hydrogen-rich water administration significantly reduced joint swelling and the levels of pro-inflammatory cytokines. A study by Aoki et al., published in Medical Gas Research, examined the effects of hydrogen-rich water on muscle fatigue in elite athletes. A study published in PLOS ONE showed that hydrogen-rich water treatment accelerated wound closure, reduced inflammation, and improved collagen deposition. The study by Professor Ostojic, effectiveness of oral and topical hydrogen for sports-related soft tissue injury. The study found that 2-week hydrogen therapy in a professional Athletes with acute soft tissue injuries significantly improve both plasma viscosity and range of motion recovery compared to traditional treatments. Recently, our lab has published a few articles on the topic. First, acute hydrotherapy with supersaturated hydrogen-rich water for ankle sprain in a professional athlete. Molecular hydrogen has recently been put forward as a possible adjunct treatment in musculoskeletal medicine. We report here a case of an elite professional athlete who suffered a grade 2 ankle sprain. Our case has indicated that an acute multi-session hydrotherapy with hydrogen-rich water may be a safe and helpful treatment in terms of pain, swelling reduction, and regaining the range of motion after an ankle sprain. We can see in the pictures immediately after the injury and 24-hour follow-up after 6 30-minute sessions of hydrotherapy with supersaturated hydrogen-rich water. Very similar study compared the effects of hydrogen-rich water hydrotherapy and the traditional RISE protocol on recovery from acute ankle sprain in professional athletes. The hydrogen-rich water group underwent intensive ankle bath, while the RISE group followed standard rest, ice, compression, and elevation. Results showed that hydrogen-rich water was as effective as the RISE protocol in reducing swelling, improving range of motion, and enhancing balance. One more study, that is buccal administration of hydrogen-producing blend after mild traumatic brain injury in a professional athlete. Sport-related mild traumatic brain injury is a serious trauma that could impair brain function of injured athlete. Molecular hydrogen is an innovative neuroprotective agent that can easily reach the brain. This case report demonstrates the efficacy and safety of hydrogen-producing dissolving tablet administered buccally during the first 24 hours post-injury in a professional soccer player who suffered a mild traumatic brain injury. The overall score for sport concussion assessment tool, a standardized method of evaluating injured athletes for concussion, increased from 68 points at baseline to 84 points at 24-hour follow-up. The future of hydrogen-rich water research and technology holds great promise for enhancing athletic performance and improving recovery from injuries. Ongoing clinical trials and mechanistic studies will provide deeper insights into its benefits and applications, while advancements in delivery systems, nanotechnology, and bioengineering will make hydrogen-rich water more accessible and effective. By staying informed about those developments, athletes and medical professionals can continue to leverage the potential of hydrogen-rich water for better health and performance outcomes. In conclusion, hydrogen-rich water offers significant benefits for a variety of sports-related injuries, including muscle strains, ligament and tendon injuries, joints for a variety of sports-related injuries, including muscle strains, ligament and tendon injuries, joint injuries, and concussion recovery. By following effective protocols such as regular and consistent consumption, hydrogen-rich water can be valuable agent in enhancing recovery, reducing inflammation, and protecting cells and tissue from oxidative damage. Integrating hydrogen-rich water into athletes' routines can lead to improved performance